I want to spend a few minutes. The section where we're going to talk about finding support, I think it'll, after all these discussions about how to handle the diagnosis, how to live with heart failure, where do you find support is a question that we still haven't answered. And we have worked towards creating a support group for heart failure for patients and their caregivers. And I think I'm excited that we're getting close to having one on a regular basis. I'd like to invite Wayne Brewer and then Janice Finder to come up and then announce the details of the support group and when and where the meeting is going to be. Hopefully, we will morph into an area where in small groups, all of you can get the resources that we need.
Go ahead, Wayne.
Okay, so as Dr. Bhimaraj mentioned, I think one of the key things, or the key tenets of this conference is really the support. And so as I was going through this whole process early on, I kept looking on the internet and trying to find support. But it would be nice to actually have support from individuals who we can see and hear. And, I have a 14-year-old and 18-year-old, and they like to go on the internet for everything. And I think they're fine probably talking to me via text all the time. But I'm sort of, quote unquote, from the old school. I like to actually talk to people. So I was like, well, why can't we have something on a regular basis? So right now, we're going to send out some information to you all, at least to get your contact information, preferred dates and times and locations, because we really want to make this really patient-centric. And what I mean by patient-centric, meaning that we want to make this focus group for you all, for all of us. We need to build a community. In order to be able to manage this thing and be able to survive and thrive, we really got to make this as focused on the needs that we have particularly. We're going to be selfish in this case. We want to really make this something for us. And so we're aiming to do this on a regular basis. We just need to figure out the days, times, and locations that work best for you. And Ms. Finder will talk more about that.
Sure. So they're going to be handing out little cards, white cards, if you're interested in being part of the support group, and we're going to have it by phone as well as attendance. We're going to try to find some place that's not as painful as coming into the medical center, right? We want to have free parking for you. We want to have security. We want to have a nice setting, and so we'll do that. It'll be once a month. It'll be about an hour. It will be your meeting, so you can choose what topics you want, what you want to talk about, how you want to talk about it. So those on the line or streaming, if you could, do they have an email they can email to us? Yeah. Okay, so if you can just email us that you're interested in the support group, and then anybody here, we're going to give out cards to you, and if you could just fill those out. Again, your name, how you want to be contacted, and what would be good for you. Like, I like Mondays at 6 o'clock. I want it Tuesdays at noon, whatever. And then we'll try to see and be as accommodating as possible. Okay, so we look forward to that, and thank you.
Thanks, Janice and Wayne. Yeah, I think we have a short video and we might have some questions.
I think there's a resilience, and it was just, it took us this long to get here, and kind of not accepting no as an answer. And so that's where you start doing your research and you find look out for other opinions. That's how we ended up at Cleveland Clinic and then here at Methodist. So just refusing to give up and take it day by day.
My son had open heart surgery. He had a congenital cardiac issue that required him to have open heart surgery 2 Christmases ago. So put all this in perspective for him. And so knowing that I have heart disease and knowing that he could have succumbed to something very similar, I think puts it in a unique light, because I talked to both him and my daughter about the need for them to get screened properly over time, because it could be more of a genetic issue. But in terms of how they perceive me and perceive, daddy's own mortality, I have yet to have that conversation. I'm almost, in some ways, a bit uncomfortable, having that with them. But on the flip side, I think there is a sense of assurement that I'm doing everything that I possibly can to stay here as long as I can.
I'm in awe over her strength. I truly am. The worst part for me was during the pregnancy, and she's supposed to wear this defibrillator vest. Well, she's pregnant. A pregnant woman needs her rest, and she can't get comfortable wearing it. So at night when she sleeps, she doesn't wear it. So each morning, I would wake up, whether it was to get ready for work or every morning, and I would look over at her and see if she was still alive. You would never know the difference. I mean, it's not like it. I could be sleeping and she could pass in the middle of the night and I wouldn't know. And so every morning, that concern, that not knowing if she was still with me or not, that was the worst part. There were times of, breakdown where you just wanted a normal pregnancy and why me? But it was as a team. We fought this as a team, and we made it through. And we're still fighting as a team, fighting as a family. Certainly her attitude and perseverance, faith, absolutely, that was the most important thing. And I was on the sideline cheering her on, doing whatever I could, and just held on to that roller coaster. I find my strength in her strength. Again, it's that perseverance of in thinking about others, thinking about her, putting her needs at the forefront, and because I need her around for a while. So we need to make sure she takes care of herself, and that she's okay. We got these two girls. They need their mom.
So when I was pregnant, he really had to step up, and he was amazing. Just helping me get dressed or shower. Never complained. Never left my side, and I mean that physically and emotionally. Like, he was so supportive when I told him that we were going to have these babies. He didn't try to talk me out of it. He jumped on board and took that leap of faith with me, and I'm so grateful for that.
And so I would just, I'd help her when needed, if whatever, and then I would just stay nearby so that if she needed anything else.
Slept every night with me in the hospital, except when ICU, he wasn't allowed. And then even in, after delivery, he was gonna sleep in the waiting room.
During pregnancy, I can't remember how far along she was, but this one night she had just horrible indigestion, just worst I'd ever seen her have it. And so I'm thinking, okay, we need to put her on an incline. She can't sleep. I don't know, it's probably midnight or something. When she can't sleep, the pregnant woman with heart failure needs her sleep. And so I'm thinking, okay, we need to incline the bed. Well, how do you incline a king-size bed at midnight? Then I said, okay, let me figure this out. So I had some plywood and ended up stacking some pillows on the floor, laying the plywood at almost like a bike ramp on that. And then I think we had some other blankets or padding that I put on top of that, and then a sheet. And so it was like this, well, maybe like this, and on the floor. And in the middle of the night, you're just out there, MacGyver this thing together with whatever you have so that, she can try and get some rest.
So I slept on a bike ramp that night. I mean, most people would just throw you another pillow, and this guy built bike ramp for me to sleep.
Yeah, in our bedroom, off to the side of the bed.
So that's how dedicated he was to helping me.
I do want to acknowledge all the caregivers. If you are able to kindly just stand up for a second, and I want us to give a round of applause to all of you who care for your loved ones. Can you please stand up, whoever is caregivers here? And I think the importance of this aspect is to really give credit and acknowledge that we want you to know we're here for you when you're caring for your loved ones, because you don't want to be left alone. And we understand the stress that you deal with, and you need to take time to take care of yourself. And when you go to the doctor's visit, you play a very important role. And some of my patients catch me because I'm talking to my patient, but I'm looking at their spouse. Because my patient's saying, no, I'm feeling okay, but then the wife or the husband is saying, oh, he's feeling bad. So I think your spouses play, or your caregivers, your kids, they watch you, and I think that helps us interact, because not that you're lying, but the body adapts. I have a lot of our patients who feel okay because they don't acknowledge that they're sick, and then people around watch them. That becomes important for us. So we'll, and again, I want to thank both Mr. Kurtz and Mrs. Eubanks. Dr. Eubanks, who's sitting here, has been dealing with heart failure for a while, and I always tell him majority of the success goes to Mrs. Eubanks, and just like Mr. Kurtz reflected in the video, I trust her med list more than our own medical records. So, accept the fact that the world is not perfect, and that's what I tell. Your pharmacy list might be wrong. The medication prescriptions can be wrong. So that's exactly why it becomes important for your caregivers and you to take control and know what you're taking, make a list, and be involved. I think there are a few questions up here which is related to the previous sections. With every exercise, will the heart be able to rehabilitate even if it isn't consistent exercise? I think exercise helps the body overall with whatever kind of exercise, and the body and the heart together rehabilitate in that regard. So the straight answer is yes for that. Is there such a thing as too much sleep for stage 4 heart failure? Too much, I don't know if there's anything called as too much sleep, but you should get good rested sleep. But the point to that statement is, and there was also a question earlier, and maybe that'll lead into we're running behind, but I think a few minutes is worth in this regard, is there was a question earlier which I think got skipped, which was about advanced heart failure. Can you have just one symptom and have advanced or stage 4 heart failure? Is reflected to the same thing here. Advanced heart failure is a little bit of a nebulous term. It just means that despite your best efforts and your doctor's best efforts, you're still struggling. So that's where all these concepts of perseverance comes in, that if you're not feeling up to what you need to feel, don't quit complaining. I mean, unless your doctor says, I'm giving up, even if your doctor says giving up, you don't have to give up, because there are resources that are available. That's where you need to look around. So if you're sleeping a lot and you're extremely tired and you have no other reasons, just because you're 65 years old doesn't mean you're exhausted that you have to sleep, right? So that doesn't make sense. If that's the case, is that stage 4 heart failure? Could be. Also, we talked about diuretics. If you're needing to take a lot of water pills to just maintain water out, then you're probably reaching that stage where you want to think about, these are end-stage heart failure, what I'm doing is not working. That's what we tell people. If you're drinking a lot of water at home and then taking a lot of water pills, then it doesn't make sense. You're going in circles. But if you're doing everything that you need to, which includes blood pressure, medications, water pills, despite your and your doctor's best efforts, if you're continuing to struggle, that is a signal to say, maybe I need to look closely that my heart's struggling into stage 4. And that actually brings into light that we want to talk about hope. We don't want to talk about stage 4. In reality, we don't want to talk about stage 4. But the reality is some people will progress into stage 4, and that's still not hopeless. And we have some of our patients here who are heart transplant patients who have mechanical heart pumps. And if one of you wants to say some words about your experience, I think it'll be a good reminder for people that there are options in today's world. Even if you read stage 4, that if there is no other choice, there are options that we have, and that's important to know before we wrap up today. And we won't talk too much into the details, but if any of our patients who are here who have a heart transplant, who have a heart pump, want to say a few words, please do. Yes, sir, while we're getting there, you're...
Most people that are on beta blockers have a cough. It's a dry cough. I think that if they were aware of that, it would reduce some of the anxiety that they experience when they have these coughing spells, especially at home.
Yeah, so the question and comment was you can have side effects with medications, and there was a specific discussion for beta blockers, which could be Coreg, metoprolol, and cough. Actually, I'm going to flip that around a little bit and say that when you have cough, unless you have a pneumonia or you have an allergy, with heart failure, if you're having cough, especially if you're laying down and having more cough, that could be fluid. So you want to be aware of that because your fluid can make you cough. The second is some of the medications, if they've just been started, like lisinopril and enalapril, which are ACE inhibitors, they are well known to cause dry cough. As pointed out, some of the beta blockers, which are carvedilol, metoprolol, can cause spasm if you have asthma and cause wheezing. But no matter what, it comes back to the fact if you're having any side effects, don't just stop taking the pills. Talk to your doctor, and what I say is some are expected side effects which go away, some are not expected, and you want to have a conversation so that one, you know what to expect, and then two, if you need to change, you change. Mr. Aker, please.
Dr. Bhimaraj, is it okay if I talk from here?
Yes, please.
Okay.
Yeah.
My name is Ken Aker. September 5th, 2017, I got a new heart. But I've had heart failure from 2003, where I had 5 bypasses done. I guess I had heart failure before then, but that's when I found out I was in heart failure. Went all the way to 2010 with a bypass, and then all of a sudden my kidneys, everything you've all said is the truth. You all listen, they're not telling you make-believe, this is the truth. But I finally ended up, 2013, another pacemaker, the heart was getting, but I did everything they said. I was learning, I didn't know this much about medicine, so shut your mouth, open your ears, and I listened to these doctors, and I did exactly what they said. And I stretched it out, so you think about it, 14 years with heart failure was a good run. But then finally, I went extreme, and my heart just decided to stop. And I was in that hospital, 10th floor, with the angels on the 10th floor here for 2 months. And I watched this team and I listened to this team, and they put a new heart in me. My support team was my daughters. And I've always been a kind of an old independent character, and I didn't need any help. Come on, I can do this. Trust me. You cannot do it yourself. Your support team is the world. I would have not survived. And the transplant team was real smart. They sort of interviewed me and my family and said, do you have a support team? Because they were not going to waste a heart on someone that didn't have a support team. So you support team people are real important. Just, want to let you know that. And I did get the extreme cure, because I talked to Dr. Bhimaraj just before lunch, and I said, do I still have heart failure? And he said, nope. I went, hallelujah. But I would not suggest you go the extreme. you can live a long time with heart failure. It's just a condition. And the other thing is I was talking about the one thing I learned that you all need to understand is I always had friends and family, but they were just, oh, that's my family, that's my friends. When you go through this, you start to understand, oh, no, I have real friends, a real family. They come out of the woodwork. Oh, they're the ones that came to visit me. Oh, they're the ones that there. My golfing buddy, he came over to the house to relieve my daughters that all got flooded during the hurricane. And he said, no, I can watch your dad. And he'd sit down, we'd tell golf stories to each other and, watch TV. So the support team is just incredible, and what you learn from it is the value of life. I've really been blessed, and I guess I've been taught the hard way that you have a choice. You can sit around and go, woe is me. Oh, poor, pitiful me. Or you can sit up and say, thank you, dear Lord. I woke up. What a beautiful day. And go positive head on. And that positive thought really, really helped me. That's about all I have to say.
Thank you.
Thank you all.